Good morning, dear students. Today in gynecology, I'm going to teach about contraception. Now, this topic also belongs to uh, community medicine. You'll also repeat this there when you study community medicine 7 and 8 semester. But having said that, this also exclusively belongs to gynecology. So in this topic, this is a bit of practical discussion. Uh, we'll learn about what is contraception, what are the different types of contraceptive method. Okay, then we'll discuss individually about each of them in short. This is a big topic if we discuss everything regarding this, but we choose only the important one and then talk in the class. Now to start with, uh, there are three types of preventing, or prevention of population control. There are three methods what we can do to prevent the birth control or to do the birth control. These are contraception, emergency contraception, and medical termination of pregnancy. Now see there, these are the three way, isn't it? Contraception prevent the fertilization, so it prevents uh, getting pregnant itself. That is the principle of contraception. Emergency contraception means, the couple don't want, that particular pregnancy. It is like by accident. Okay, there are so many different way by somebody may get pregnant, and now they may regret. They may want to avoid that particular pregnancy, so they may use certain medicine, especially the lady may use certain medicine so that implantation cannot happen, and without implantation the baby will not grow. Okay, this is known as emergency contraception. We'll talk about it. And the last one is abortion, medical termination of pregnancy. Now, uh, it is different in different countries because this is controlled by the government. It has to be according to the government rule. But there are certain medical indications for medical termination of pregnancy or abortion. For example, if a lady becomes pregnant after rape, okay, now this has a strong medical background uh, for termination of pregnancy. So these are the three ways. Now today we are not going to talk the last one, but we are going to focus on contraception and emergency contraception. Now, what is contraception then? A method or a system which allows intercourse and yet prevents conception is called a contraceptive method. Conception is prevented. Okay, this contraception may be two types: temporary and permanent. One is temporary, another is permanent. Now see there, temporary means when the effect of preventing pregnancy lasts while the couple uses the method, but the fertility returns immediately or within a few months of its discontinuation. That's why it is called temporary. It lasts when they use it. After they stop using it, okay, she becomes fertile again. Okay, so this is temporary contraception, and most of the contraception which we use are a temporary one. The permanent contraceptive methods are surgical. Okay, surgical. Now look at the surgical terms here: tubectomy in a female and vasectomy in a male. Tubectomy and vasectomy. Now, what do you mean by vasectomy? Yes.
Sir, vasectomy is the removal
Sir, we remove the
of
waste
the vasa
septum, sir.
differentia. So during this procedure, sir, the vasa differentia cut or sir, they are tied or sealed. So the sperm can be prevented. So this is a permanent contraception in male.
Exactly. Very good. Vasectomy. The vas term is there. This vas is vas difference. Okay, or ductus difference. That vas difference is the tube which transport uh, sperm from where? Epididymis to the seminal vesicle. So it is a long tube. So we cut this tube so that sperm cannot be transported from epididymis to the seminal vesicle, then that person becomes sterile. This is a permanent type of contraception because a small part of the vas deferens is cut and it is tied on both sides. Okay, so this is a permanent way. This is done in male. Whereas tubectomy, okay, is a similar type of surgery where we sacrifice or cut fallopian tube. Okay, fallopian tubes. A small part of the fallopian tube is either cut or ligated. Okay, so this is tubectomy. Both of these are permanent one. So the decision has to be made by the family, especially by that lady, whether she wants to go for it or not. We need consent to do it. We are not doing it forcefully from our side. She has to be ready for this. So this is a very important one. Not only her, the family has to be ready. Otherwise there will be conflict later on. Yes, from the some legal perspective, we don't need to take the familial consent here, but okay, from other point of view, to avoid the conflict later on in the family, even the husbands and other family members, it would be better if they give consent. Unfortunately, no contraception has proved perfect. This is very important point. Okay, no contraception has proved perfect, and its effectiveness, safety, and techniques vary. This therefore requires extensive counseling, screening of the couple, and offering the best method which is suited to them. So there are so many different choices, so many. Okay, sometimes we call it cafeteria approach. We put everything in front of them and they need to choose what is best. But before that, we need to give a lot of knowledge to them, isn't it? That is called counseling. Okay, then we may screen them. Sometimes if they are having certain medical conditions or medical disorder, we cannot prescribe or give certain types of contraceptive method, like a hormonal contraceptive, which cannot be given in certain conditions. We'll talk about that. So we always offer what is the best thing for them, and they are the one to choose that. This is known as informed consent. Let's move on. Now, the choice of contraception depends upon the following factors. The first thing is availability, and second thing is cost. Availability and the cost. It should be very cheap and it should be freely available everywhere. Another factor is age and parity of the couple. Now, which contraception they want to choose depends on the age and parity of the couple also. For example, if the lady is a little bit on the later half of her fertile period, okay, for example, she has already completed her family, she is more than 35 years of old, let's talk like that. So she probably wants to go for permanent type of contraception. Okay, reliability is another important point, that is failure rate. We have to clearly tell what is the chance of getting pregnant after using this contraception. Okay, so they should be careful. Regarding the side effect and contraindication to a particular method, okay, it really determines which type of contraception we choose or we offer to them. The most important type here is hormonal type of contraceptive. They are associated with a lot of side effects, and there are lots of contraindication also exist there. Advantages and disadvantages, each of them we need to explain. Requirement of follow-up is necessary. Again, when we use hormonal contraceptive or other hormonal type of method, and then extensive counseling is done and we allow the couple to make a suitable choice. Okay, you don't say, oh, if I was in your place, I would have taken that, or I would have chosen that. This is not a proper type of counseling. This is like a directional type of counseling. Okay, I am telling my choice to them. This is not the way. Now, the most important slide regarding today's class is this one. Okay, if any question comes from this topic, we love to ask this first, and then probably one other, like any one of them we want you to discuss. So see this. So there are different methods of contraception: natural method, barrier contraceptive, and so many other. Now let's know the names types here first. Natural methods of contraception is abstinence during the fertile phase. Okay, abstinence means avoiding sexual intercourse or avoiding coitus during the fertile phase. Now the problem here is the couple should know what is the fertile phase. Okay, and we'll talk about it. This fertile phase can be known by different method. Okay, one is called calendar method. Calendar method. Another is mucus method. The female may check the cervical mucus, and because of the different hormonal effect, the the mucus will either be thinner or slippery or a bit of thicker. So this is because of estrogen and progesterone effect. We'll talk about that. Another method is temperature method. Remember, you have studied this. What is the effect of progesterone hormone regarding temperature? Yes?
Increase temperature by 0.5.
Literal increase in temperature, sir.
Very
0.5.
good. Very good. Excellent. So most of the students know this. Excellent. So it raises the body temperature. Not that high, maybe 0.5 degrees centigrade or something like that after the ovulation occurs. It starts right there. Okay. If she takes a temperature every day, which is a bit of cumbersome method, of course, but this is nevertheless, this is one of the method to know when is the time for ovulation, isn't it? So these are some of the way, and if they know, they avoid sexual intercourse during this time, then they are safe from getting pregnant. Another type of natural method is called coitus interruptus, okay, or withdrawal during sexual intercourse. Coitus interruptus. We'll talk about it. And another way is breastfeeding. If the lady is breastfeeding regularly, okay, after the birth of the baby, then till 6 months she's safe. 6 months, but she has to breastfeed every day. Okay, every day. If she misses breastfeeding in some of the day, then she will not be protected from this. This is mainly done by the effect of prolactin hormone. Okay, so we'll a little bit talk about each of them in the subsequent slide. The second important methods of contraception are the barrier contraceptives. Barrier. Okay, barrier contraceptive means they don't allow the fusion of sperm with ovum, or they don't allow sperm to climb up. Okay, they create some barrier there. That is the meaning. So condoms are the most commonly used barrier contraceptives. There are male condoms and there are female condoms, but female condoms are not that commonly used, and male condoms are probably the most commonly used method of contraception, along with hormonal contraceptive. Others are spermicidal agent. Spermicidal agent. These are the chemical substances which kills the sperm. Quite easy to understand. Spermicidal agent. But if we use them alone, they may not be very effective. But if we use them along with condom or some other barrier type of contraceptives, they are very effective. Other types of barrier contraceptives are diaphragm. Now, diaphragm is also known as cervical cap. Okay, cervical cap, so that sperm cannot ascend up into the uterine cavity or into the cervix. Then some of the hormones, especially progesterone hormone, can be used there locally, and the effect of progesterone hormone there is it makes that cervical mucus very thick. Okay, it will convert the cervical mucus into very thick mucus, so that the sperm cannot penetrate that thick mucus and enter into the cervical canal. Okay, so one of the important type of contraception here is known as mini pill. Mini pill. Okay, it is made up of progesterone hormone. Okay, so important one we are going to highlight. And rest of the methods of contraception are IUCD. Okay, IUCD, intrauterine contraceptive device, one of the important way. Another is suppression of spermatogenesis in case of male. If the spermatogenesis itself is suppressed, remember, then the person becomes sterile. Suppression of ovulation with hormone, and that is known as hormonal contraceptive, probably the most important part of this lecture. A lot of questions can be asked from there, and all over the world, if you take a data, which is the most commonly used contraceptive method, probably hormonal and barrier comes into the picture. Then post-coital contraception, also known as emergency contraception. The coitus has already occurred, and this is unprotected sex has occurred, so there is a chance of getting pregnant. Now, how to stop the lady from getting pregnant? This is post-coital contraception. Some of the immunological method, they are still under study, they're still under research. Okay, and if they are successful, then it is very easy. It's very easy for the couple. And the last one is surgical sterilization. That is the permanent type, tubectomy and vasectomy. Now look at this picture here. These are some of the type, so all may not be shown here, but some of the types are definitely shown. This is the natural way of family planning or contraception. This is known as calendar method. Now there is a vaginal ring type of barrier one, contraceptive patch, hormonal one, oral contraceptive, definitely hormonal, IUD or intrauterine contraceptive device, also known as IUCD. Here is shown as copper T. This is known as copper T. This is the injectable type of contraceptive. Please mute yourself. Okay, this is injectable type of contraceptive. This is the condoms, male and female. So these are different types shown here. Okay, I'm getting a bit of disturbance here somewhere. Okay, fine. Now see here, this is vasectomy. What is shown here? See, this is the testes. Okay, here is epididymis. So this is the vas deferens. So they have cut the vas deferens and tied on both side or both end. This is a permanent type of contraception. It can be done so easily. Okay, this is the OPD type of procedure. Okay, if you just see one or two, the third or the fourth one, or after that, you can do this on your own. The intern doctor or the medical officer who are quite unexperienced can also do this. This is tubectomy. Okay, this is tubectomy. See there. So what they do in tubectomy, we all know that. So they cut the fallopian tube. See, these are the different way of tubectomy. One is cut and cauterize on both ends so that they are blocked. Another is tied and cut, and third is clipping or banding. So these are the different types of tubectomy. Tubectomy can be done by conventional surgery. A small incision is given on the abdominal wall and direct approach would be taken. Another is by laparoscopy, laparoscopic tubectomy or tubal ligation. And third is hysteroscopic tubal ligation can also be done. Okay, so these are the different way: conventional, laparoscopic, and hysteroscopic tubectomy or tubal ligation. This is also a permanent type. Now, before we move further, let's talk about what is the failure rate of any contraceptive method. So all contraceptives, or any types of contraceptive, they are not perfect. There is always some amount of failure rate. So how we, talk about that failure rate of any contraceptive method? Now, this is done by Paul index. Okay, Pearl index. Now, this Pearl index is described in terms of pregnancy rate per 100 woman years. The meaning of 100 woman years means 100 women over 1 year of use. So, if 100 women have used that particular contraceptive method over 1 year, how many of them got pregnant? So accordingly, we calculate the failure rate of any contraceptive method. Remember, contraceptives contraception are provided to block the pregnancy, to inhibit the pregnancy. If they are getting pregnant, that means this contraception has failed to protect that. Okay, so it is the failure rate. This is known as Pearl index. The ideal contraceptive method should be effective, long acting, safe, coital independent, and reversible. So we are talking about the temporary one now. Besides, they should be available and affordable with minimal side effect. So these are some of the important characteristic features of contraceptive method. But let me repeat again, no contraceptive method is the ideal one. Now, all of you, please focus on this slide. This slide is talking about the effectiveness of contraceptive method. Okay, talking about the Pearl index here. Now, I'll give you one small task here. From this slide, tell me which is the most effective contraceptive method. Okay, that is your job. Okay, all of you, please focus there.
Spermicidal, sir.
Yes. See it again, all of you. So just see there. Just take a bit of time.
So I would go with the surgery because it's permanent and it's effective, and so like there's no chance of conception after it.
Okay, that is one good point. I'll come to you. Okay. Now see this. So when you go through this, there are a lot of concepts given here. On this side, it is less effective. On this side, it is more effective. And the reason here is less than 1 pregnancy per 100 women in a year. Okay. So the failure rate is less than 1 year. And on this side, 18 or more pregnancy per 100 women in a year. So this is a high failure rate. Okay. For example, condom has got high failure rate. There are different reasons associated with that. Sometimes there is slippage of the condom. Sometimes they don't use condom effectively. Sometimes condom may burst. Okay, so a lot of reasons are there. A female condom, 21%. The withdrawal or coitus interruptus, 22%. Okay, use of vaginal sponge and things like that. Spermicidal, see it? Spermicidal, 28%. It's less effective. But if we combine this spermicidal with something else, then probably it would be better. Okay, all these calendar method, they also fail if they wrongly calculate it. Now look here, these are the hormonal one. Okay, around 6%, the injectable. These are the pills, 9%, patch, ring, diaphragm, all of those are different types of contraception. And then this IUD, okay, copper T, or this is the progesterone hormone known as levonorgestrel. Different type of implant kept inside the body, like norplant is one of them. These are also a type of hormones which are kept. These are very highly effective, And sterilization, see this? Look at the percentage, 0.15% of failure rate and 0.5% of failure rate. Still not zero. And there is a reason behind it. Do you know what is the reason why this permanent type of sterilization also have a very, very little chance of having pregnancy? Why? Anybody? There is a reason. What may be that? And the reason is, okay, now remember, when we do vasectomy, for 3 months after vasectomy, we still want that male to use condom when there is sexual intercourse, because some of the sperms may be present there in the tubes, okay, maybe in the seminal vesicles. All of that, okay, should come out. Then only the permanent type of sterilization will work. Okay, around 12 ejaculation. Remember this important point. 12 ejaculation has to be, protected or prevented to enter into the female genitalia. That is usually done by barrier types of contraception or condom. So somehow, if this message is not given to them, then immediately after surgery, what the person think? Oh, I'm safe now. I don't need to worry about about the babies and things like that. But that is a mistake. So there is still a chance of getting pregnant. Okay. Otherwise, yes, he's right. This permanent type of sterilization or contraception is the best one. Okay, among all, and it doesn't have any side effect also. Okay, you can all go through this on your own. Now let's move further. These are the different types of contraception according to the duration of action. Duration of action. These are long acting, medium acting, and short acting. Now let's quickly go through them. These long acting are 3 monthly oral tablets, 3 monthly intramuscular injections, implants, IUCD, and surgical method. So they are long acting. 3 monthly, that's why they are long acting. Surgical method is permanent, okay? You don't need to worry about it. Others are a bit long acting. This implant is an implantation of some small tube-like things which are containing hormones. They slowly release the hormone and they are implanted or inserted usually on the arm area, okay, or on the forearm, especially on the arms. Medium acting, given weekly or monthly injections, and short acting, like condoms or barrier method, postcoital, daily pills, and skin patches. So these are the different types according to the duration of action. Now let's talk about each of them. Very important points are only highlighted here. Now, first is the natural method of family planning. So, abstinence during the fertile phase is one of the practice, okay, one of the method which has been practiced from a long time, and till today a lot of couple they practice this. Okay, a lot of couple they practice this, and it is a very good one because there is no use of any drugs, any medicine, isn't it? So it is a bit of mentally satisfying actually, but at the same time it has a high failure rate if they forget to calculate it properly, or if they do not know what is the fertile phase exactly, then there is a chance of getting pregnant. So fertility awareness means the woman learns to know when the fertile time starts and when it ends. The fertile phase of the menstrual cycle can be predicted in various ways. Okay, this is one of the important lesson you have to learn from today's class. Okay, so please pay attention here. Now let's talk about the calendar method or the rhythm method. This depends upon the avoidance of sexual intercourse around the ovulation time. Now we should exactly know when is that ovulation time, and that is a risky period because ova is getting released, and if sperm is present in the genital tract during that time, the lady can become pregnant easily. In a 28-day cycle, ovulation normally occurs on the 14th day. You all know that. We have discussed this so many times before. But it may occur anytime between the 12th and the 16th day. So a little bit, time is given, okay, 12th and 16th day. Spermatozoa deposited in the female genital tract may survive for 24 hours. The ovum itself may live for 12 to 24 hours. So to accommodate all these different time frame, so we are talking like this from 12th to 16th day. So intercourse between the 11th and 17th day, they result in pregnancy in this calendar method. Now, one very important point you need to understand here is the menstrual cycle should be regular. See this 28-day cycle. Then only you can be confirmed like this. If the menstrual cycles are irregular, then this duration is not certain. This duration is not certain. So from 11th to 17th day is the risky period. If they avoid sexual intercourse in this time, okay, then there is no chance of pregnancy. This is known as calendar method or the rhythm method. Now, another point, if her menstrual cycle is irregular, for example, a long type of menstrual cycle, 35-day. Now, when is the ovulation time in a 35-day cycle? When?
Sir, 21.
Yes. How did you get that?
Sir, we subtract the 14-day period, sir.
Exactly. Very good. So we have explained this before. If you have paid attention, whatever long or length of the menstrual cycle is there, okay, you just need to subtract 14 days. So 35 minus 14 is 21 or 21st. Okay. So therefore, ovulation will occur on the 21st day, that is 14th day before the next period. So that the risk period is from day 18 to day 24. Okay. So this is the way. So see this 3 days, okay, on that side and 3 days on this side. So 18 to 25 days to be absolutely sure you don't have a sexual intercourse in this period, and then you will be fine. Now, there is another method to calculate, which is the safe period. Okay, this is known as Naus-Ogino method. Naus-Ogino method. What this Naus-Ogino method is all about. The fertile period is determined by subtracting 18 days from the shortest cycle and 10 days from the longest cycle, which gives the first and the last day of fertile period respectively. So this is a good one if somebody is having irregular cycle, and so many female they are having it, and on one month they are having 28-day cycle, and the next month they are maybe having 32-day, and then again 34-day like that. So this is the way to calculate the a safe or unsafe period. Subtract 18 days from the shortest one and 10 days from the longest one. This method will result in approximately 25 pregnancies per 100 woman years. So it is not very reliable at all. And I already explained to you the reason. If they calculate it wrongly, then she may get pregnant easily. The failure results from irregular ovulation or from irregular menstrual cycle. And some couple prefer this method on religious ground or because they find other methods unacceptable. I already told you in the very beginning, this is like a cafeteria approach. You give all the different types of method or different type of approach to them, and it is their responsibility to choose. And after that, you should tell them what are the chance of failure in each of them, what is the best way in each of them. It is the job of ours. Now, another one to know the time of ovulation. It's a type of natural method of family planning. Is the Mucus method. Okay. Now, this also we have studied before. It is also known as Billings or ovulation method. The properties of the cervical mucus change under the influence of ovarian hormone on different days of the menstrual cycle. Now, see there. The woman attempts to predict the fertile period by feeling the cervical mucus here. Okay, so she has to feel the cervical mucus on her own, and then what is the nature of the cervical mucus? Accordingly, she will judge when is the ovulation time. Under estrogen influence, the mucus increases in quantity and becomes progressively more slippery and elastic until a peak is reached. Thereafter, the mucus becomes thicker, becomes lesser, that is scanty, and dry under the influence of progesterone until the onset of menses occur. So clearly it is written what is the effect of estrogen on the cervical mucus and what is the effect of progesterone hormone on the cervical mucus. Now the day when this elastic and slippery mucus will change into a thicker and scanty one, the day when it start to change, that is the time of ovulation, because after ovulation the progesterone hormone starts to be secreted. That is the knowledge. Now another type of method is called temperature method. Temperature method. Okay, now students have very correctly answered, so they know it already. Progesterone is known to exert a thermogenic effect on the body. So therefore, if the woman records her basal body temperature daily on the morning and plots the readings graphically, the basal body temperature chart will be biphasic in an ovulatory cycle. It clearly shows, okay, what is the time of ovulation. Okay, there is a clear-cut indication on the chart. The day of temperature shift indicates the time of ovulation. And now what should they do? Once the time of ovulation is found out, avoidance of intercourse should be done. Okay. So all of these are natural methods. Remember that this is all about the avoidance of sexual intercourse on the day of ovulation. Then they can avoid the unwanted pregnancies. This is called temperature method. Now let me quickly revise whatever we have discussed till now. We are talking about the natural methods of family planning or contraception, and this natural method is all about knowing exactly where is the ovulation occur, and that can be done by calendar method, that can be done by a mucus method, or that can be done by temperature method. These are the three more common one. Okay, and then that risky period should be avoided regarding sexual intercourse. Now, I was talking about the different methods of natural contraception. So one of that is the withdrawal method, also known as coitus interruptus. Okay, this coitus interruptus is a common practice. Many couple wants to go for it, and in this type of family planning or contraception, coitus takes place in a normal manner, but the male genitalia or the penis is withdrawn immediately before ejaculation. Means ejaculation is avoided inside the female genitalia or inside the vagina. This is known as withdrawal method or coitus interruptus. It has a pregnancy rate of approximately 25 per 100 woman years. So this is not reliable. This is not reliable at all. The main cause of the failure is not that ejaculation occurs inside the vagina, but the prostatic fluid secreted prior to ejaculation may have some active sperms, isn't it? Before the real ejaculation, there is some lubrication, there is some fluid comes, okay, slippery type of fluid that is made of a prostatic fluid, and that may already have got active sperms. No. Okay, so that may lead to fertilization. There are certain advantages and disadvantages of this coitus interruptus. The advantages are, okay, no cost or no contraindications, no systemic side effect, and no effect on the lactation because they are not using any drugs or any other substances there. And disadvantages are failure rate is high. Okay. Failure rate is high. It requires motivation, and no protection against HIV and STD is there, because if one of the partner is having sexually transmitted disease like HIV or even herpes simplex virus or human papilloma virus, things like that, other partner can easily get it. Okay. Nevertheless, these are some of the way of family planning or contraception. Let's move on. Now, what about breastfeeding? What is the role of breastfeeding regarding family planning? Regular breastfeeding with at least one feed at night is shown to prevent pregnancy for 6 months. I already talked about that in the beginning of this lecture. So at least one feed at night is shown to prevent pregnancy for 6 months with a failure rate of only 0.5 to 1.5%. So this is a good one, in comparison to so many other natural way. But it gives protection for 6 months only after the birth of the baby. And the point here is there should be regular breastfeeding. This occurs due to prolactin, which prevent LH surge and ovulation. So if there is no ovulation, there is no chance of fertilization. Beyond 6 months of breastfeeding, prolactin level falls and ovulation can occur. Okay, so after 6 months, she has to go for some other modality of contraception. Only breastfeeding may not be protective. So this is very, very important knowledge we need to provide to her. It is the frequency rather than the duration of feed that decides non-ovulation in a nursing mother. Frequency means every day. It is important one. If she misses, for example, in 1 month time, if she misses 1 or 2, then she would be unprotected during that time. If sexual intercourse occur, she may get pregnant.